Dear friends, welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today's topic is examination of the lids. What are the things we have to examine while we are seeing the lids with the torchlight? The things we have to examine are the skin over the lids, lid margins, eyelashes, lid position, lid movements. First, let us talk about the skin of the eyelids. The skin of the eyelid should have the same color as the skin of the rest of the body. When the eyelids are fully closed, you can see a crease on the upper eyelid. The crease will be a single crease. It will be horizontal. This is where the lid folds when we open the eyes. This is the normal anatomy of the eyelid skin. Suppose a patient is having problem in the eyelids. I am going to talk about the common problems that will be met by undergraduate students. The lids may be red in color or black in color. When you will see such a colored eyelids, when there is a fresh subcutaneous hemorrhage, it will be red in color. When the hemorrhage is a long-standing one, the lids become black in color. So, this is a classical example of ecchymosis of the eyelids, which is very common in contusion injuries of the eye. Sometimes in the lid, you can see swellings. The swelling may be close to the lid margin or it may be away from the lid margin. A swelling which is very close to the lid margin with very high signs of inflammation, then it should be a case of hordeolum externum or style. If the swelling is away from the lid margin with high signs of inflammation, then it should be a hordeolum internum. If the swelling is away from the lid margin but hardly there is any sign of inflammation, then it has to be a chalazion. Sometimes you can have a small swelling close to the lid margin and it will not have pain. That will be in a case of marginal chalazion. One more condition which an undergraduate student will commonly come across is swollen eyelids. The lids will be swollen completely. It will be edematous. You don't see the horizontal skin crease at all. This is very classically seen in preseptal cellulitis. It is also seen in orbital cellulitis. So these are some of the common conditions that will be seen by the undergraduates in the skin of the lids. Now let us see about the position of the lids. When the eyes are open, the lower lid will be exactly at the lower limbus. The upper lid will cover 1/6 of the cornea. About 2 millimeters of the cornea it will cover normally. When the lids are closed, both the upper and lower lid will touch. There will not be any gap. What are the abnormalities usually we see? For the first thing is ptosis. Ptosis is nothing but drooping of the upper eyelid. Drooping means even when the eyes are fully opened by the patient, the lid covers more than 1/6 of the cornea. That is called as ptosis. There are several types of ptosis. Ptosis may be due to paralysis of levator palpebrae superioris muscle. It may be a mechanical ptosis. Swelling of the eyelid may drag the lid downwards. There are so many causes. Next we go to the retraction of the lids. The lids are open widely, just like a demon or a Ravana in the Ramayana serial. The sclera will be seen. So this is called as retraction of the eyelids. This may be due to spasm of the muscles or due to some contraction of the skin. So these are some of the examples. Next, what we are going to see is the lag of ophthalmos. Lag of ophthalmos is incomplete closure of the lids. Even when the patient tries to close the eyelids fully, he is not able to do. Some portion of the eye is open. There is some gap between the upper and lower eyelid. This is called as lag of ophthalmos. A classical example for lag of ophthalmos is facial nerve paralysis, where the orbicularis muscle is not able to close the eyes. Sometimes the eye may be protruding outwards, so the lid is not able to cover it. Next, we will see about the movements of the eyelids. You should ask the patient to gently close and open the eyes. If the movements are brisk and smooth, then the movements of the eyelids are normal. Sometimes, in a condition called as thyroid ophthalmopathy, the movements may be affected. It may be slow in closing or opening the eyelids. Thyroid ophthalmopathy is one of the classical example of lid lag. Regards to the lid margin, you should know how a normal lid margin looks like. I have drawn a picture of a lid here. The conjunctival side of the lid margin will be sharp. It will be right angle. The skin side of the lid margin will be curved. It will not be sharp. If you see the lid margin, it will have a grey line in between. There will be a grey line here in the center. Anteriorly, you can see the eyelashes coming out. Posteriorly, you will see multiple dots. Multiple greyish dots will be seen. These are the opening of the meibomian gland. This is a normal anatomy of the lid margin. Now, you should know what are the abnormalities that can occur or we can see in the lid margin. The lid margin may be inflamed and red in color. It is classical of blepharitis. Blepharitis is nothing but inflammation of the lid margin. In the margin of the lid, you can see scales or white dandruff-like materials, which is classical of blepharitis. Sometimes the lid may be turned outwards, that is called as ectropion, eversion of the eyelid margins. Sometimes the lid may be turned towards the eye itself, inversion of the lid margin, that is called as entropion. So these are some of the conditions that we will commonly come across in the lid margin. In this picture, I have drawn a tarsal plate with meibomian gland inside, and here at the base of the eyelashes I have drawn a hair follicle with small glands nearby. So this is the meibomian gland, this is the glands of Zeiss and mold. If there is a acute suppurative inflammation of the glands of Zeiss or mold in the lid margin, then that is called as horridum externum or stye, and that will present with the pus point. The pus point will be there at the root of the eyelashes. If there is acute suppurative inflammation of the meibomian gland, that is called as hordeolum internum, that will present with the pus pointing on the palpebral conjunctiva opposite to the inflamed gland. It is time to see about the eyelashes. What is the normal anatomy of the eyelashes? In the upper eyelid, there will be 2 rows of eyelashes, and in the lower eyelid, there will be 1 row of eyelashes. What is the direction of the eyelashes? The upper eyelid, the eyelashes will be directed forwards, upwards, and laterally. Forwards, upwards, and laterally. The lower eyelids, the lashes will be directed forwards, downwards, and laterally. That will be the normal direction of the eyelashes. The eyelashes will not be present medial to the lacrimal punctum. You cannot see the eyelashes medial to the lacrimal punctum. It will be present only lateral to the lacrimal punctum. Now, let us see what are all the abnormalities that can be caused by the improper eyelashes. One is called as dystichiasis. Dystichiasis. There is an extra row of eyelashes. So here you can see 2 rows are there. Both of them are present in the anterior lid margin. Here you can see 3 rows. The third row is close to the posterior lid margin. So what will happen? The posterior most row of eyelashes will cause irritation to the eyes. Sometimes it may cause corneal ulceration. The next abnormality with the eyelashes is trichiasis. Trichiasis means abnormally directed or misdirected eyelashes. Already we have told the upper eyelid lashes will be forward, upwards, and laterally. The lower eyelid lashes will be forward, downwards, and laterally. If this direction is changed, then that is called as trichiasis. Trichiasis is usually seen in case of blepharitis, or it may be a congenital one. Trichiasis is very dangerous because an eyelash which is directed towards the cornea may cause a corneal ulceration and permanent visual loss. The next abnormality with the eyelashes is madarosis. Madarosis means loss of eyelashes. You don't see eyelashes here. A small rudiment is here. Most of the eyelashes are shed due to ulceration of the lid margin. This is called as madarosis. The fourth abnormality with the eyelashes is scoliosis. Usually, even at the extreme of old age, the eyelashes will be black in color. Even if all the hairs in the body have become white in color, this does not change its color at all. Very rarely it will change. But if eyelash hairs become white in color at a very young age or earlier, that is called as scoliosis. Scoliosis is connected with the deficiency of melanin pigments. Today we have discussed about the lid and abnormalities commonly that will be seen by undergraduate students. Let us see in another structure in the next video.